The easiest way to describe a duodenal switch is you take a sleeve gastrectomy and you add to that intestinal bypass. This is an operation that has two different stages or two different steps. The first step is to do a gastric sleeve on the patient's stomach. Now, the sleeve that we create with duodenal switch is going to be a larger stomach than we would do if we were just going to surgery to do a gastric sleeve, because these patients will have more capacity, to eat and drink than they would if they had just gone to surgery to have a gastric sleeve. And then the second part of the operation is intestinal bypass. And the way we do that is there's a little valve at the end of the stomach called the pylorus, and beyond that is what's called the duodenum, which is the first portion of the small intestine. And we divide the duodenum with the stapler just beyond the pylorus. You count backwards from where the small intestine joins the colon, and you bring that up to that staple line on the cuff of duodenum, and that's where you do your connection. So when the patients eat and drink after surgery, of course, they swallow their food. It goes down their esophagus into their sleeve stomach, so their portions are smaller. And then after the stomach empties itself through the pylorus muscle, and it goes into that little piece of duodenum that's left. And then through there, it goes into the intestinal tract. It's bypassing the majority of the intestine. This is the most powerful weight loss procedure that we perform, in the United States. If you look at the results of a duodenal switch, the weight loss is the greatest amount statistically. You're talking 80% of excess weight, even 100% of excess weight. Because it works in two different ways. It works with the sleeve part. You have reduced portions and reduced hunger with the sleeve gastrectomy. And then you add to that intestinal bypass. So your food is being rerouted into your intestinal tract, so your body doesn't have the opportunity to absorb what you eat or drink after surgery like it does now, because it's not going to travel through as much small intestine because of the bypass of the intestinal tract. Duodenal switch is performed laparoscopically, just like gastric sleeve and gastric bypass. Hospital stay is going to be longer than gastric sleeve and gastric bypass, probably going to be definitely 2 nights, maybe 3 nights in the hospital. The diet progression after surgery is the same. You're going to do clear liquids and then thick liquids and then semi-solid food. Just like you do with all the operations, the diet progression is the same. The difference after surgery comes definitely with the vitamins. Because of the amount of intestinal bypass that we have with this surgery, the vitamins that patients take after surgery are very, very important. They're on a different vitamin regimen than gastric sleeve or gastric bypass. You have to take in about 200% of your daily multivitamin requirement after the surgery. So along with extra vitamin A, extra vitamin D, E, and K, extra multivitamin, extra calcium. The risk of this surgery, again, is gastrointestinal surgery, so nausea is a potential problem. Vomiting, of course. After surgery, these patients will experience intolerances to certain types of foods, especially fatty or greasy foods. They tend to have cramping, and it can even result in some loose stool. This operation does carry additional risk because, again, we're not only are we dividing tissue, but we're moving the intestine around and we're reconnecting it so that where that connection is, that anastomosis, there's a risk of that not healing appropriately. Because we're moving the intestine around, there's a risk of intestinal obstruction down the road from adhesions which form naturally in the abdominal cavity. The other risk with this surgery, again, comes with the amount of intestine that's bypassed, and it comes with the malabsorption. Patients have to be very, very compliant with their diet. They have to get their protein in every day. They have to meet their nutritional needs with their vitamins and their liquids. If you get behind on protein, you get behind on your liquids, it's very easy to get yourself in a situation where you're malnourished and you're losing too much weight, or you're not maintaining yourself well. So that's the big risk with duodenal switch. It's the least common operation that's performed in the United States, but it also has the greatest benefits. If you look at weight loss, you look at resolution of diabetes, resolution of high blood pressure, resolution of high cholesterol, duodenal switch beats all the operations. The reason it's going to be getting more and more popular in the United States is because it's part of that operation is gastric sleeve. There's a lot of patients who've had or will have or are having now are having gastric sleeve because it's such a good operation. But there's going to be a percentage of those patients who have that surgery and need to lose additional weight, who gain weight down the road after their gastric sleeve, and they're going to come back and they're going to want something else done. And so you've already done the gastric sleeve part, so the natural progression is to go back and just do the intestinal bypass part, and those patients can start losing weight again.